I'm excited for you guys to hear this. Let's welcome Jonathan Coddington.
So thank you, Ben. My friend JB, JP, and Ben John for inviting me to come out and have a conversation with you guys about maybe the role of a broker. I am a recovering broker. That's what we like to call it. For those of you that used to be advisors and now aren't, we're recovering. We can't quite ever leave it. But I like to start out all these things. I've got 4 kids. The 13-year-old goes, "What are you doing this week?" And I said, "Well, I'm going to go talk for the guys at Self-Fund Health about what I used to do for a living." And she goes, "Like, how many people are going to be there?" I said, 250-ish. She goes, "Won't you be nervous to talk?" And I said, "No, they're just cool people, like normal people, no big deal." She goes, "What'd you do last week?" I said, "I got to do a fireside chat with Mark Cuban, which was really cool." So they think I'm a rock star. So if this is a really good talk and you like it, make sure to send me some notes so I can tell my 13-year-old I did a good job. But yeah, I did move all 4 kids and my wife to Minneapolis to chase a dream. And the dream is to change the way healthcare is financed, disclosed, and delivered. You'll see that same message on Eric's setup out here. TPAC was a close strategic partner of mine as a broker. And so as I was getting ready for all of this and thinking about what I used to do for a living and getting to talk to you guys about it and gals, my wife is a big fan of ChatGPT. So I said, gee, I wonder what Chat would say the role of a broker is. So here it is. I didn't know I needed a disclosure. Where's Ann Lewandowski? The rest of this is all mine, but this is Chat's. So we'll get the legal stuff out of the way. If I were a self-funded health plan, the employer assumes the risk. So trusted advisor, project manager, mitigates risk, ensures compliance, contains cost, supporting employee engagement and satisfaction. That's pretty dang good, right? Almost. So I believe it's a strategic, trusted advisor. Like, you can't just be an advisor. It needs to be strategic. I'm going to talk a little bit about some strategy that maybe you can employ if you're not employing it today. And then we don't want satisfied members. I'm sorry, we don't. That might be a shock to you. We don't want satisfied members. We want raving fans, right? Because raving fans are the ones that are going to say, you know what, I'm willing to think differently about healthcare, right? We don't want satisfied. Satisfied means they get the same thing they've always had, right? So we've got to think about doing things differently. So why am I here? I spent 22 years in the brokerage business, 10 of it doing self-funded health plans the way Self-Fund Health is suggesting you all build your plans here. We had direct primary care on the front end of everything that we did. We learned that lesson over time. Didn't start out that way. We started out with one of the big box carriers that everyone knows and loves, and then kind of iterated from there, always finding the next best place. So part of this talk is a journey. We didn't get our clients. We had about 100 self-funded clients, which is a lot in the middle of nowhere, Virginia. Okay, we didn't get there overnight. So think of what you're doing as a journey. That just going self-funded is the start, not the end. So we'll talk about some of that. Primary care, like what Self-Fund is talking about today, primary care has to be on the front end. Why? We don't need Slido. Why does primary care have to be on the front end? This is going to be client. You have to talk back. This is going to be really, really weird for me. Why do we need primary care on the front end? Just one idea. Anybody? Say it again. Access. What was that? Stay out of the hospital system. Here's what we found. I could tell a member all day and twice on Sundays what I thought they should do for healthcare. When we got a nurse or a doctor involved, they listened, right? So I believe the best way to begin to change the way healthcare is financed, disclosed, and delivered is not to demonize the provider. It's actually to engage that provider and bring them into the conversation, a conversation they're not allowed to be in today. right? So, primary care on the front end, cost containment around all of it, okay? Primary care, once they understand what you're trying to do, they buy in 100%, okay? Now, yes, could it be improved here or there? Sure. What we ended up doing because we had no DPC providers in our area is we built a near-site clinic shared by 21 employers, about 2,000 lives, right? So there's a way to do this. If you want to do it, it can get done. Within 18 months, those 21 employers saw a return on that investment. 1.8, so it returned almost double what we paid for it. And we had better access, et cetera, and so on. So if you don't have DPC in your area, but you have employer groups that you're working with that are willing to think differently about healthcare, think about a near site. But at the end of the day, what I got tired of, and perhaps my friends at Yuzu are different, right? They work with TPAC as well. But what I got tired of was telling employers that we could do X, Y, or Z only to find out either the system the TPA was working on wasn't capable of doing X, Y, or Z. The folks at the TPA weren't able to administer the plan the way we needed it to, right? I think Jonathan, I call him JB because calling someone else Jonathan when your first name is Jonathan is weird. JB admitted to it earlier, right? Like you have to iterate. You have to start somewhere, and where you start is not where you're gonna end up, right? So I went through 6 different TPAs, right? And we just kept running into problems. So he said, you know what? Why don't we try to do it ourselves? So we started a TPA, went live like 40 days ago. It's not pleasant. I wouldn't recommend it. But it's gonna be some good work once we get rolling. So, geez, that's bright light. All right, so what does self-fund health offer? As I was thinking about like the conversation today, employers and brokers in the room, they're not paying me to say this. Like, this is good stuff. Think about, like now as a broker, I had to put all this stuff together myself. I had to understand stop loss that Dr. Smith was talking about earlier. I had to understand all these things. I had to build it. At the end of the day, if self-fund health is doing all of these things for you, what can you as the employer and broker begin to do? Focus on 1 or 2 things. Employee engagement and education, right? And strategy. So let's talk about a couple of these as you're kind of thinking through the life cycle of your health plan over 12 months. So, reality check. You heard it earlier, I'm gonna say it again. Not every employer should be self-funded, period. Now, I do believe every employer could be self-funded at some point in their life cycle, but not all of them can be self-funded right away. So don't try to jam a square peg in a round hole. And we'll talk about some, I've got all kinds. I like to talk in word pictures and stories because I think that relates to folks, so I've got a lot of word pictures and stories to talk through. My suggestion, it was not self-serving. My suggestion, I would not take an employer self-funded unless they committed to 3 years initially, okay? Just wouldn't do it. Not worth, we might as well just pack up and go home. If we're looking at the back door while we walk in the front door, forget it. We have to commit. Otherwise, we're just wasting time and money, okay? So we'll talk about that. The goal is not to save money. Sorry, that's not the reason to go self-funded. The reason is to control the healthcare experience that your employees have and give them a better one than they can get on their own today, okay? And frankly, I think we need to be sincere and honest with ourselves, right? You as an employer know if you're ready to go self-funded, right? How do you know that? I'll answer the question. How do you know? If you have a proper, strategic, trusted advisor sitting with you on your side of the desk, okay, whose only compensation comes from you, okay, they'll be able to help you figure that out because they have no misaligned incentives, okay? And we'll talk some about that. And I'm not beating up brokers. I was a good one for many years, for over a decade before I found self-funded health plans built right. And once you see a lot of what you've seen today and yesterday, you can't unsee it. It's like the Matrix, right? You want the red pill or the blue pill, right? You can't unsee it. you can't go back to your normal health plan, right? So, whoops, backwards. So one of the things that I found very interesting in working with TPAC, and this is not a commercial for them either, but from a strategic perspective, as an employer and broker in the room, listen to this. There is a way to figure out if you're paying the right price for insurance today. It's not hard. That's how I sold so much business and helped so many employers, right? I would walk into their office and I would say, when's the last time someone told you if what you were paying was the right price? And not once did I have someone say, I've never heard it. What do you mean the right price? There is a way, TPAC is not the only carrier on the market that does this. They can give your group a risk score of A to what? G? I. If you're an I, don't go self-funded, right? Don't do it. If you're an A, let's talk about it, okay? A through I. They can identify conditions on your health plan, not the person, but the condition that could be the buzzsaw that destroys your health plan if you go self-funded, that you need to remain fully insured, right? So we would help employers understand when the right time to go self-funded was. Look at the stats. 25% of our clients in my former employer were self-funded. 75 are still fully insured. There's nothing wrong with being fully insured if you've made the right decision to remain there, right? Now, once you go self-funded, you got to commit. Sometimes employers are not ready to commit. So let's talk about that. The other thing I would tell you, the two things I would talk to an employer about, okay, which were very different. So I'm giving you the secret sauce here, broker friends. Two things. Number one was financial stability, right, for their plan. Get that risk score, make sure we're not making a big bad mistake. Second thing, I wanted to talk about corporate culture. Brokers, when's the last time you talked to your employer about their corporate culture and what their corporate culture can withstand when it comes to a health plan and a shift, bless you, and a shift from fully insured to self-funded? When's the last time? I never met an employer in 11 years of selling self-funded health plans that had a broker come talk to them about their corporate culture and why that was super important. If your employees feel like, okay, employers in the room, if they feel like an asset, I heard paternalistic earlier. Those are my favorite clients. I love paternalistic clients because they really cared about their employees, right? If there's a high level of trust that your employees feel like you do things with them, not to them, okay, not pointing fingers, those employees like that get self-funded health plans. They will take that call from the nurse. They will do what the nurse says. They will call in proactively and ask. Are any of you ESOPs in the room? Anyone know what an ESOP is? ESOP, awesome. ESOPs, I found to be the best self-funded employee, it's best by far. Why? Because if the employer wins financially, the employees win financially. If there's more profit at the end of the year, stock price goes up. I just made more money as an ESOP, right? Participant. So if you've not figured out brokers, ESOPs yet, and you want to do self-funded business with self-fund health or anyone, I'd suggest maybe look at ESOPs because typically their corporate culture is one that they're already bought in. They're all in it together, right? So if, however, your employees feel like they're an expense, which some businesses are run like that, okay? If your employees feel like you're always trying to get one over on them, right? Those are not good businesses to take self-fund. I was having lunch with an employer here. The jerk chicken was fantastic, by the way. If no one had it, you missed out. And he said that he was part of a health plan a couple of years ago that went self-funded, and there was a union involved. And the union members threw such a fit after the decision was made to go self-funded that they ended the plan 6 months in. Can you imagine? That's a disaster, right? So, like, yikes. Don't let that happen. You as the broker and you as the employer need to have an honest conversation about whether or not your corporate culture will allow a self-funded health plan to thrive, right, or die. Oh, brokers, we love our shiny objects. I love shiny objects. I want to chase them all at once, right? My poor account managers, I would walk into the office with an idea and you would just see them wish me death right there. just drop over dead from that heart attack that Preston was talking about earlier. I would maintain that the best stop-loss relationships that I had were ones where we didn't shop the stop-loss every year. Why do it? Why find the cheapest price? Because what ends up happening is when your client needs, brokers, employers, when your client needs that fair renewal that they don't deserve because they just left the last 3 carriers, right? That's when the entire market says, not it. And now you've got a 99% renewal, or you have to take a massive laser that you know you're gonna have to pay, or they just non-renew the policy. Good luck. How'd that happen? Okay? I would maintain that you as a broker, if you're gonna work with someone like Self-Fund Health, who's managing that relationship for you, right? I didn't clear this with Jonathan ahead of time, JB, but if it were me, I would take my point solution treasures that I've found, my shiny objects, and I would bring them to them and say, I found this, can you vet it for me? Like, what if everyone in this room was a Self-Fund Health client, right? That'd be great. He says, maybe it'd be okay. That'd be great, right? What if all of you were having a conversation about this is why we're using Capital RX, to use someone who was presenting earlier, right? This is why we use Capital RX, and we're all agreeing to use Capital RX. And because of that, we have a better deal than if we each individually went to them. Does that kind of make sense? Right? Okay, so that's literally what they're doing. How many lives?
6,000. 6,000.
6,000 lives. Does 6,000 lives have more buying power in the marketplace than, is any one employer in here over 6,000 lives? No, right? So that buying power, if you are not harnessing that together, you're missing out, right? So, disconnected point solutions break everything. I could interview Yuzu right now, and I guarantee you they would tell you, if what they are doing is not integrated, look, she's doing this. If it's not integrated, it breaks the entire system. They can't operationalize anything, right? So one broker bringing a 72 life case with this PBM and that point solution, forget it. It's why the industry doesn't work well. Don't do it. All right, brokers, here's what I think you should do. If they're gonna handle the stop loss, the RX, they're gonna tell the TPA, GTPA, we need you to do this and pay claims and do that. And we're gonna handle the cash price, and we're gonna do all these things. That leaves 4 things for the broker and the employer together to work on. Relationship building, okay? I lived in a small town. I loved walking into, we had Food Line. Anyone know about Food Line? Anyone? Yes, my man down front. Okay, a couple more. Food Line. All right. So I love walking into Food Line and walking down an aisle and running into a member on a health plan. I loved it, okay? Because we could engage with that member, right? Hey, Billy, how you doing? Or Bob. Bob was who we were talking about earlier, right? And like Bob would walk up to me at church and say, hey, you have a minute? No, I'm at church. I don't want to talk about your knee, okay? But I loved it. Why? Because when I needed to call Bob, he knew who I was. As a TPA or as Self-Fund Health, unless it's a nurse calling that's already gotten trust with that member, who's the number one person to get trust with that member? My friends in human resources, where you at? Human HR? Oh, look, raise your hands higher than that. That's the hardest job in the dang room. All right, HR, okay, be proud of it. That's you guys and gals, HR, and my friend the brokers, okay? Without that interaction to manage those members who do not want to engage but need to, your health plan fails, right? You cost yourselves way more money than you need to. That relationship is key, because Self-Fund Health is not in every community. Y'all are the community out there. You've got to bring that sense of community into that health plan. They can't do it for you. That is the broker's number one job. Now, once they do that job well, my opinion and my experience, and if I'm wrong, you can approach me later, okay? If you do the relationship building properly, that leads to education opportunities. The open enrollment meeting was just like part of what we're doing, okay? It was part of 1 month of the 12-month cycle of something that we were educating on every month if an employer would let us, right? Don't be afraid of that. And then the strategy, and then you gotta mitigate risk. So, I already talked about that, boring. Open enrollment meetings are just part of it. Lunch and learns, toolbox talks. Like if you're having a toolbox talk for your workers' comp carrier, invite your healthcare broker in to talk about your health plan if you're self-funded. Don't miss that opportunity. Newsletters, I ghost wrote all kinds of stuff. So get this one. Because we had normal conversation with members, we had a poor lady with cancer who knew that we had a imaging opportunity where she paid nothing, okay? So she actively pursued it during her chemo treatments for her scans to see how the tumor was doing and saved that employer of 52 people $49,000 in 1 year. She was thrilled. They gave her like mileage to and from the facility where she got the MRI. Like she was getting paid to go get this thing done. Case study. Oh boy, someone already mentioned transition to Medicare. 90% of the time, my experience, the only reason the person who is Medicare eligible is still on the plan is because they didn't understand what their options actually were. Now, can you force, that's always the question, can I force someone on to Medicare? No, you can't force them. You also can't incentivize them, that's illegal. But what you can do is educate them, right? I had one employer of 232 people, I believe it was. We had 14 individuals come off the health plan the next year, okay, because we educated them during the year about what their options were. 14. The other broker that we took the case from could have done it. They didn't, right? I would suggest that is the broker's role. I had a situation where, where's my nurses in the room? Where are my nurses? Okay, we got 3 paying attention, 4. Anyone? 5? All right. So, nurses. I had a nurse navigator find someone who, a mom called in, couldn't make her rent payments. Her husband, the plan member, the employee was on disability, couldn't make her rent payments, was worried, called in just to ask for help, because it's a nurse. Everyone asks a nurse for help, right? She's part of the health plan. Did that make her stop? No. What she did, she found a community resource that helped give her $1,000 to pay her rent. Now, did that save the health plan any money? No. But if you think differently about this, when that member returned, how happy was that member to talk about nurse navigation? To anyone who would listen, right? Think about this thing differently. 501R, has anyone ever heard of 501R, not you two? No hands, 501R? Oh boy, 501R, charity care. Hospitals have to give away care to people who earn below a certain threshold, even if they're not insured. Or if they are, it doesn't matter, okay? Pay attention to that stuff. I had a guy who's a good friend of mine, 52 years old. They found a widowmaker artery in his heart, right? Kills you. You have a stroke, you're dead, okay? His mom died when she was 53. He's 52 today. At 49, because we had a primary care doctor involved with his employer, and we had talked to him for the last 3 years about why he needed to go to the doctor, and it was free, and the PET scan he got after that was free, he's still alive. They found it. He would not have gone to the doctor and would not have had the scan done because he couldn't afford it. I was in Subway, and I hear this guy yell, that clinic you started saved my life. How important is that? Would that have happened in a fully insured plan? No. No, it wouldn't have. Self-funding is part of your strategic corporate mission and vision. That's the only way self-funded health plans work best. It's got to be integrated in your business, okay? Multi-year plan tied to company values. Brokers, talk them into a 3-year commitment. You can do it. Employers, get talked into it. Make the strategic shift. 9 months on the merry-go-round, 3 months paying attention to your 27% rate increase, 9 months not paying attention, 3 months paying attention to a 21% rate increase. You can't do it, right? Here's what we did. Employers that we worked with committed beforehand that if this thing works, Jonathan, and you're not lying to me, we will give some of this money we save back to the employees. How much more committed are the employees to potential change if they know they get to share in it? Premium holidays. Come Christmas, we had multiple employers who did not take a payroll deduction in the month of December for health insurance as a give back to employees if their health plan performed well. Multiple employers in my past life, some since 2014 when I launched my first self-funded health plan, are still self-funded. They still have not raised payroll deductions in a decade because of their self-funded health plans, right? A decade. I'm gonna take you to all my presentations. Deductible buy-downs, right? I have an employer who in 2014 also joined a self-funded health plan like this that Self-Fund Health is building. They bought their deductibles down from $2,000 to $500. They've not raised them. They brought out-of-pocket maximums down to $2,500. They've not raised them, right? Like that's what can help with this. Removing barriers to care. Dirty secret. Fully insured health plans, underpriced consumer-driven healthcare plans because they want your members in them, because they avoid care. They don't have consumerism. They just avoid care till it's too sick. And now where do they end up? In the massive hospital system our friend Preston told us about, who makes $1 kajillion, right? The other thing you need to understand about healthcare financing is this. The fully insured market, the only way the fully insured market makes more money as an insurance company, watch this, is if the total cost of care goes up. Why? Anyone remember the Affordable Care Act? Medical loss ratios, 15 to 20%. That's the only thing that they can keep. Everything else has to be returned in claims, right? So the only way to make 15 or 20% larger is what? Okay. C-suites, brokers, you have to talk about mitigating risk. Has your broker talked to you about an orphan drug exclusion? Anyone? Okay, you need to know about it. I would suggest talking, figuring it out. It's a drug that only less than, I think, 200,000 people in the US take, and therefore it's an orphan drug, and it can be excluded. It's tough. It can be excluded. One of those on your health plan could wipe you out. That you need to talk about. You need to understand those options. I got this from a broker friend in Ohio. What if you structured your health plan in such a way that if someone was over the age of 65, but their family members were under 65, your plan still made their family members eligible even if they weren't on the plan? I was pissed. I didn't think of that myself, right? That's good stuff. That 65-year-old wants to go off and get Medicare, fine. Work with your plan design folks on your self-funded health plan to do that. I had an employer who had someone with a chronic kidney disease on end-stage renal, right? They had left them on the plan because they loved him. He'd been there for 33 years. Good dude. Still alive, by the way. So when we met him and we started to take him self-funded, I had to go talk to him and be like, look, this guy can't continue on your self-funded health plan because he's not eligible. He doesn't work enough hours. He hasn't in over a year. Like, we have a problem. You're about to leave your fully insured plan, and this guy is holding you hostage. There's a solution, but you're not going to like it. You have to take him off your health plan, okay? See some nods. Now, you don't have to be heartless about it. This employer loved this guy. So what'd they do? They built a health reimbursement arrangement that if you'd been with the company more than 30 years, everyone there would qualify for, that if you had to leave work, okay, and had to go out and get an individual policy, they would help you pay your deductibles and your premiums, and it's legal, okay? Anyone who'd been there more than 30 years had that same opportunity. So they literally gave this guy $100,000 and said, we love you, good luck. Because of that, he was able to pay his premium and his deductibles out of pockets, had no expense for his health care. He was able to do as his doctor told him, which was quit working and take care of himself, and he's alive to this day because of it. Like, there are things that you guys can do if you get creative about this thing that can actually change someone's life. in the right way. Pharmacy carve-outs, you guys know about them. Self-fund health does all that. J-code management, if you're not talking about it, you should be. If you don't know what a J-code is, we can do that in Q&A. Care navigation is a must. Cash prices, this Yuzu thing is nuts, dude. Like, do that. That's fantastic. Long-term strategic shift. We already covered spousal HRAs. ICRA. Did someone mention ICRA up here before?
I did.
You did. Anyone ever? I hate ICRA. It's a terrible idea, okay? Because it's you as an employer basically abdicating the throne and saying, good luck, employee. Good luck. I'm going to cap my expense at your whatever, sorry. But it's a way, it's a strategy. You might not like it, but you might not have a choice. I had an employee who had no choice. He had to shut down his health plan. He had to go ICRA. It's the only way to stay in business. Know that that's a strategy. At the end of the day, back to chat. The other thing it asked me after it gave me a definition, let's see, and then I'm done. Oh, it asked me if I wanted a checklist that I could use to grade a broker on. Yikes. Yikes. And a lot of it was, Number 10, though, was genius. It said, make sure the broker aligns with your company's values, goals, and decision-making styles. Who grades brokers like that? Brokers, do you grade clients to see if they're a proper fit? I've fired clients. Like, we decided to part ways. I helped them find another broker because I could not help them, okay? Has capacity and interest to serve your organization with appropriateness and responsiveness. Chat should become a broker, right? This is good stuff. So, it requires employer culture of trust. It requires a multi-year strategy, or it will fail. No, that's the wrong way. Self-funding is a movement. We've already heard that today. It's not just a funding strategy. You have to find the right partners, create a long-term win. Thank you for investing in your people, for those who already have gone this direction. Doctors, thank you for going out on a limb, right, to serve patients. This is the future. Thank you. Right?
To, previous advisors, right? I did not have 100 self-funded clients, I'll have you know, so that's fantastic. But I did, so this is kind of a story time, right?
Yeah.
When I first met John, I literally remember talking to another broker friend, and John pitched his idea and everything. This is like 2021 or 2 or something. And I think, kind of embarrassed to admit this now, but literally like my thought was, they're idiots, this is never gonna work. Like that's like literally my thought was that will never work, because I had started to see, getting into self-funding, not as early as you did, but I had started to see the complexities and the friction and the issues with it. And I thought, this is truly so case-by-case basis, so customizable, that there is really no way to operate and scale a health plan that is going to be an aligned, self-funded plan, as easy and as simple to use as a BUCA carrier. And then I got some more experience, and a year or 2 later, I talked to him again, and the more I knew, the more I realized, you know what? I think he's actually onto something here. And it was a few months after that where I realized that the scalability, with the software, doing it the right way, the nurse navigation, everything you talked about now was like, this is potentially the answer to a scalable solution that can make a bigger dent in healthcare in general. So if you're a broker still, Jonathan, your broker hat's still on, okay? And you know everything you know now, okay? We're in Virginia, and Self-Fund Health pops on the scene, and you're doing the same thing. In a sense, you're a DIYer, you're doing it yourself with your clients, clearly very successfully. Why would you use Self-Fund Health, or would you not use Self-Fund Health? Because this is something we get asked a lot about from employers, because every broker in here could find the components to create a health plan, right? So I'm really asking based on fit for these employers here, for them to vet us and to know, is this a good fit or not, or to go a different direction and to lay it all out on the line from a third party, right? Technically competition,
Yeah.
president of a TPA that we're not using. What is your answer to that?
So it required, like, I got to where I got because it required someone else who had experience, who kind of took me under their wing and said, you know what, let me teach you about this business of self-funding, right? Now, they didn't know. He would tell you today, I should not give him credit because what we ended up building in Virginia was so much bigger than he ever thought possible, with the navigation and the clinic but it does. I was sitting at a table with some brokers earlier, and the stop loss thing was over, and they're like, wow, right? Like, there is so much institutional knowledge that self-fund health can bring to an employer and a broker that they don't have to have themselves. That I think that's the value, right? Is that you can bring that expert in immediately to help make sure that this is the right decision for you, and already has the infrastructure built. Like I said, it took me 10 years to get it built, bless you, to where, I mean, self-fund health is now, right? So
let's flip it. Why wouldn't you use self-fund health?
if they weren't innovating, if they weren't kind of being thought leaders, if they weren't willing to talk through, like the stuff that wasn't going right.
What about issues you see currently?
Such as?
The potential issues that you would see in using an all-in-one solution.
All-in-one solution? Yeah. I mean, as a broker, right, your employer client has been taught that you need to go RFP this and RFP that and RFP this and RFP that. Like, at the end of the day, that's the danger, is that if you bring in an all-in-one solution like Blue Cross or self-fund health, you have to compare them against each other every couple of years, or else you're not doing your fiduciary duty, right? There's some truth to that. But on a self-funded health plan, to bring in an all-in-one solution, not many of them exist anymore. I mean, most of the time it's a broker that has had enough or sees an opportunity that puts together a few clients, but you can't scale it that way, right? Whereas if you're able to bring in navigation and like a TPA that's already figured out this cash price thing, and like all the components of what self-fund health has done, I don't see any reason not to use it.
Okay. I gave him every opportunity. Just, you heard, all right? Well, here's this thing, though, is that you said that the TPAs that you went through, and hence why you're trying to start one, right? Yep. What is the issue? It's the operational aspect of a health plan. Literally just the operations of paying a dang claim and processing it the correct way. Correct. Sounds fairly simple to you, but actually
turns out it's kind of hard.
Turns out it's pretty difficult, especially when you're dealing with thousands and thousands and thousands of claims. And so the TPA partnership is gigantic. And you went through, you said 6 or 7. And I remember you telling me in a previous conversation that they would hit about 8,000 to 10,000 employees and then fall apart and just fizzle out. And then all of a sudden it was like, we can't use these guys anymore because they have taken on too much operational stress to even function in the core ways that they are supposed to as a third-party administrator.
Or, in the case of a couple of them, they were good, and then they got acquired.
Oh, sure.
And the acquiring party was either a healthcare system, a Blue Cross or United or Aetna entity, or private equity. And none of those ended well. It was a good TPA that got worse. Because now it was monetizing every single transaction as opposed to taking care of the basics, blocking and tackling. Like, y'all, I get to say y'all, this is fun. There's a lot of you. I literally had a customer service person at a TPA tell the CEO's wife that they would pay her claim when her employer paid their premium. Yeah? That was real warm and fuzzy conversation I had when he called me as the broker and just ripped me up down one side, down the other, as he should have. Like, the TPA space, like when it was started initially in the 80s, it was a way to say, look, like what's happening right now with ERISA and all these things, and the carriers aren't doing a good job of it. Right. We can do better. It was a customer, like a member service, a customer service. It's not if you're trying to monetize every transaction.
So what they were built for is not what they're
and it's hard. It's dang hard. Like
what we're intending them to do, they're not capable of doing, is essentially what you're saying.
Or they're incentivized not to.
Or they're incentivized not to.
You ought to give the folks at Yuzu a hug for those that use them on the way out the door, because it is way harder than it looks. Okay? Way harder than it looks. Just give them a hug.
Some of the clients here know, because they were with the other one that shall not be named. Okay, really quick. So what is a J-code? A J-code drug is a pharmaceutical drug that is applied to the medical side of the plan, not the prescription PBM side of the plan. So these are drugs traditionally that are extremely expensive. Think MS, autoimmune disorder medications. A lot of them are either injectables or ones that are infused, where you actually go sit in a chair and get it infused in your arm. That's a J-code drug. So it's still a drug. It just happens to hit the medical side of the plan, not the PBM RX side of the plan. And if you can mitigate and control the J-codes, you are going to do a lot of good for your plan. And it's something that we are constantly obsessing over at Cell Phone Health with the nurses, and how we're able to interact with patients that have these J-code drugs. So 100% getting into self-funding, one of the top 10, top 5 priorities is those J-codes. So that's that answer. Okay, there's some spicy ones in here, so let's get through a couple more, because this is a good topic, and I think it's good that we're talking about this stuff. We want to get it out there. We want to discuss this because, again, we all want to push this thing forward. So this is probably from a broker, and it's pretty straightforward. What's working the best to get C-suite buy-in? So classic scenario, I'll paint a scenario. You talk with an HR, and they're on board. So maybe it's more about how to get organizational alignment. And then the CFO is like, oh yeah, I love this because I see the numbers, I see the potential, and the HR sees disruption. That's the classic, assumption anyway. Right. Or vice versa, the HR is like, I love this, but my CFO has nothing to do with this, and he just sees more work, and So how are we getting the buy-in from the C-suite in that organizational?
Where are my HR people again? No offense when I say this. They don't pay attention to you in the C-suite.
That is hurtful.
Did I hear an amen? Heck yeah. All right. So that's the problem. How many CFOs and CEOs are in the room right now?
They're not going to raise their hand now.
Okay, not many, but a ton of HR people. I think the CFO and the CEO, or one of the two, should be here now instead of the HR person. Why? Because the HR, you guys are the implementers in that organization, right? You're not seen necessarily as strategic, right? In most, let's just talk truth. You're the implementer. You're gonna go and implement. The members trust you, okay? The way I got CFOs and CEOs interested in what we were doing is by literally asking, like, HR, I have to get the CFO and the CEO in the room if this is gonna work, okay? So it's not that I wouldn't take meetings with just HR, it's that I would explain to HR that this was gonna be a waste of their time unless we had the CEO and the CFO in the room. And once they're there, they can't unsee this stuff. I would just give them story after story. Like I negotiated our first travel medical tourism myself. I called the provider in South Carolina who's really good at hips, and I said, my employer client who has more money than he knows what to do with wants to pay you outside of his health plan to do his hip, okay? Because you're the best at what he needs to have done. He's done all his research. I said, we are a self-funded health plan. I'm a broker. Here's what I'm proposing. Don't let him pay you. Let the health plan pay you. We will pay you the $25,000, okay? And he said, cool. I negotiated myself because I cared about that employer. And I said, look, if it doesn't work, owner of company, then you're still out 25 grand yourself. You were gonna do it anyway. If we run it through your health plan, at least then it's a medical expense, right? He felt so good after the one hip, he had the second one done 2 weeks later, right? Like he was literally walking stairs after the procedure. What ended up happening was he didn't need a hip replacement, he just needed it resurfaced. But the guy in our local hometown who does a couple of hips a month was going to tear him apart, right? We had a situation, I could tell you stories after stories, that we had an HR person who was going to have their chest cracked open and had open heart surgery to repair a valve. Turns out, we got a second opinion. All of our health plans had free second opinion services, okay? And they got a second opinion because HR listened to this presentation like you all are listening to now, and they knew they had a second opinion service. And they went to Oklahoma Heart Hospital in Oklahoma City, Oklahoma, which is the best heart hospital in the nation, with one of the best doctors to do what she needed to have done. She saved the health plan over $130,000. She herself got a new heart valve and $2,500 in her pocket, and she and her husband got flown to Oklahoma City and back, and the health plan still saved $130,000. And she was out of work for 2.5 weeks, not 3 months, because they went up through her femoral artery with a laser and a camera, snip, snip, done, right? That's what you need to bring to your health plans, is that. You guys are doing this stuff.
We got lots of examples like that, yeah, for sure. Even in our short time, we've got plenty. All right, we're getting the chokes. I need to address this next one. and I love that we're getting these. I mean, truly, these are good discussions. Why aren't the largest broker firms, cough, cough, M3, at the front line of healthcare reform? Here's what I found, you guys. Like, truly, it comes down to the individual person, okay? I mean, like, would you say that every server at Olive Garden is trash and not on the front lines of being a good server? You would never say that, right? There's probably the one server you're like, I love this server. Like when we go to Olive Garden for the endless soup, salad, whatever it is.
Breadsticks.
Thank you. I hope Diane is our server, right? And then there's other ones where you're like, I don't really like him. Don't jive with him. I mean, it literally is the same thing. I mean, some people at your employer care about their jobs and care about continuing education and care about providing the best service. Some don't, So like there are a lot of misconceptions, and being a former advisor and then being hired to sell to advisors, I'm not saying this just to, placate and brown nose and stuff like that. Like, yeah, are there advisors that I don't see eye to eye with that I would prefer not to do work with? Yeah, 100%, right? And are there advisors that I really like? Are there advisors who want to do the right thing but just haven't been shown how yet? Yes. So it's like direct primary care providers. You meet one direct primary care provider, you've met one direct primary care provider, And so I would say the same thing about the brokers. So we do work with some M3 agents. I would just urge everybody here, especially employers, to understand that it really is down to the individual person, not necessarily the agency as a whole. And so there's a lot more I could say about that if you want to pick my brain later. But brokers especially, I want to give a shout out that Jonathan's first meeting, agenda with an employer, that he runs the meeting, like if he's just cold to an employer and he runs a first meeting, highly, highly recommend you email him for that conversation that he has, if you have the gumption to actually do it the way that he does it, which you might not. But if you are willing to do that, it is unlike anything that I've ever heard. So brokers in the audience, I would 100% reach out to him for it if you want to know how to get 100 self-funded clients.
You're going to have to remind me what that is.